Hi, guys, and welcome to Making It on Monday. I'm your host, Amy, and today we're doing all about COVID and how it impacts fertility, and also if you're going to get vaccinated, when you should get vaccinated. So, recently I attended FSA, which is the Fertility Society of Australia and New Zealand. It's the annual conference, and there I was lucky enough to have a fantastic lecture by an American epidemiologist who told us all about the risk of COVID to both those people trying to conceive and once you're pregnant, and male and female fertility. And also all about sort of vaccination and the safety and efficacy around vaccination. So today I just wanted to share with you what I learned, because I found that it was one of the best presentations I saw. And I'm gonna load you guys up with quite a lot of kind of pretty heavy hitting statistics. But I'm hoping you get some really good takeaway messages, because I know so many of our patients come in and they asking when is a really good time to get a vaccine. Should they get a vaccine if they're pregnant? And so now I feel a lot better equipped knowing this research to answer those questions, and that's what I'm going to try and answer for you today. So to start with, basically vaccines are incredibly effective at preventing infection and also preventing hospitalization and death. And we know that actually there is an effect of COVID for male fertility in particular. And we did a Making It on Monday all about this with Rhiannon Hardingham, who's a naturopath and nutritionist. And she talked all about the impact of getting COVID on male health. In terms of female fertility, outside of it having maybe a delay or impact on the menstrual cycle, we're not really sure if actually it does impact fertility. So, however, if you're trying to conceive, the end game, right, is for you to get pregnant. And once you are pregnant, you're actually quite vulnerable when it comes to COVID. So I'm not sure if so many of you are aware of the statistics around COVID. So once you are pregnant, you're 5 times more likely to be hospitalized, which is kind of crazy. You're also 3 times more likely to require ventilation. You're 2.4 times more likely to be admitted to ICU. And you're 1.7 times more likely to die from COVID. So they're pretty sobering statistics for people pregnant. Conceive, sometimes you feel like, oh, but I'm right in the middle of a cycle and I don't know when is the best time to get vaccinated. If you're due for a booster or you get to be vaccinated, it's really the same thing that we're talking about in terms of coverage. So if you're a man, at any point, it's probably, if you're trying to conceive, you really want to make sure that you're up to date, because it's going to really reduce your risk of infection. And it's also going to make sure if you do have COVID, that you are probably going to have a lot less, more mild kind of version of COVID, and hopefully that will reduce the impact, particularly on male fertility. After speaking to Rhiannon, she suggested if you're doing an IVF cycle and the male has had COVID, that she suggested actually trying to delay it for a couple of months, because you won't get the same outcomes for the 3 months prior after having COVID. So there's been numerous reports on male reproductive injury after COVID infection, so there's nothing new. And there's quite a few different theories on why, around immune-mediated responses and also the impact of fever. But Rhiannon talks a lot more about this, so you can listen to this if you're interested in particular on male fertility. So ideally, what can you do? Ideally, get vaccinated or boosted prior to conceiving. And they suggest to do this at any time, including during your IVF cycle. The only time where you should be potential to not get vaccinated is the 7-day window around an embryo transfer. And the reason around this is because that 7 days around embryo transfer, you don't want to be changing your body's immune response at that time. when we take a vaccination, there's a lot of antigens produced, and it changes the immune reaction. And we don't want that around implantation time, around embryo transfer time. Okay, so outside of the 7 days window around embryo transfer, it's fine to have a vaccination at any point during your IVF treatment or trying to conceive naturally. And they also say that it's completely fine to have a vaccination at any point in your pregnancy, including early pregnancy, that there's been no research to suggest that it increases miscarriage rates. We've got very clear statistics on that. And so if you have conceived, but you're due for a booster, it's probably worthwhile considering having that booster, given your vulnerability to have COVID and its severity. So once pregnant, there's no particular time that you can to get vaccinated. You can get vaccinated at any point. And finally, I just want to end, because we went through quite a lot of the myths around COVID vaccination and fertility and pregnancy. And so currently there's, according to the leading epidemiologists and all the scientific research that's come out, there's no known or theoretical impact of the COVID vaccine on male or female fertility, or in pregnancy on the developing fetus. So myths around the vaccine impacting fertility have been disproven. There has been no increase of miscarriage associated with a COVID vaccination. And I found this is very reassuring research, because, of course, when patients are asking us, what do we think? Should we take, should I get vaccinated? Will continue for them to suggest that they talk to their fertility specialist about this and make decisions with them or with their GP, because, of course, as Chinese medicine practitioners, it's out of our scope of practice. But I did, after watching this at the Fertility Society of Australia annual conference, after watching this fantastic presentation, I just wanted to share some of the research and one of the most kind of current findings with all of you. And hopefully for some of you who are either trying to conceive or pregnant, and you're due for a booster and you really want to avoid getting COVID because of those risk factors, hopefully this research has been kind of helpful for you, help guiding your decisions. I'm going to leave some links to the research that I've been talking about today, so you can look into it a little bit further if you'd like to. But my name is Amy Forth, and that's it for Making It on Monday for me today. And I hope you found it really interesting, and I hope you all have a fantastic rest of your week. And if you would like to join us over on our private Facebook fertility and IVF support group, please do. There we have many recordings of Making It on Mondays, and you can connect with me and my co-host Lou if you have any questions. It's a great little community, so please come and join us there. Otherwise, we'll see you soon for Making It on Monday. Thanks so much. See you. Bye.